Welcome to another continuing education program brought to you by Northeastern University, Bouvet College of Health Sciences, School of Pharmacy, and the Continuing Education Department. The title for today's presentation is Over-the-Counter Weight Loss Supplements. What exactly is out there? My name is Jason Lancaster, and I am currently an assistant clinical professor at Northeastern University. I have four major objectives that each of you should be able to fulfill at the conclusion of this lecture. The first being to be able to calculate a patient's body mass index using their weight, whether given in pounds or kilograms. The second being to categorize each product discussed based on its proposed mechanism for weight loss. The third being able to recognize common over-the-counter or OTC weight loss products by their chemical or scientific or herbal names where applicable. And the fourth objective, which is a comprehensive one, is to be able to formulate an appropriate recommendation for an over-the-counter weight loss product, giving consideration to the following patient-specific criteria: their appropriate or candidacy for use, any associated comorbidities, as well as the contraindications to use either for that patient or for the medication. Now that we've discussed a little bit about the objectives, let's jump right into the lecture. The products and items pictured here only begin to scratch the surface at the total number of over-the-counter weight loss supplements or products that are available currently in the United States. One item you may be surprised to find categorized as a weight loss supplement is the One-A-Day Weight Smart Advanced Multivitamin. The reason for this being that the One-A-Day, in addition to having its usual multivitamin properties, also has several stimulants within it, which are proposed to help patients lose weight. Again, it is important to keep in mind that there is only one FDA-approved product for weight loss at this time, and I'll point that out later. As such, the rest of these products have not undergone any rigorous testing and have not been evaluated by the Food and Drug Administration for their safety. So why are we even discussing over-the-counter weight loss supplements today? Well, you can see that in 2001, the retail sales of just weight loss supplements alone exceeded $1 billion. In 2004, at least 20% of all Americans reported taking greater than or equal to one weight loss supplement, with most taking more than one. And it is also anticipated that by 2010, the total weight loss market in the United States will exceed $65 billion. Now, that market also accounts for dietary products such as diet sodas, dietary foods, and surgeries. But a big chunk of this will, in fact, be the use of weight loss supplements. Before we can discuss the individual products, we need to know who is approved or who is safe to use these weight loss supplements in. Self-treatment may be utilized in patients as an adjunct to diet and exercise, in patients who have a body mass index of greater than or equal to 30, but as we'll see, one of the exclusions is a body mass index greater than or equal to 40, as well as a BMI that may be greater than or equal to 27, but with limited comorbid disease states that may benefit from additional weight loss. And the two that you should be focusing on are patients with sleep apnea or osteoarthritis. So if that's the list of patients who are eligible for self-treatment with an over-the-counter weight loss supplement, we certainly have to have an exclusion list. Those patients who are excluded from self-treatment include anyone with severe obesity, which is defined as a body mass index of greater than or equal to 40, anyone who is pregnant or breastfeeding, anyone who is younger than the age of 18 or older than 65 years, anyone who has an eating disorder, and anyone with comorbidities including cardiovascular disease, anyone with diabetes or hypertension. So I've used the term BMI or body mass index previously, but now we're going to take a few moments just to discuss what it actually is. Your BMI is the indicator of body fatness, and it is derived from patient's height and weight formula. And you can see there are two forms depending on whether or not you're using the patient's weight in pounds or kilograms. If you have a patient's weight in kilograms, you use their weight in kilograms divided by their height in meters squared. And if you have their weight in pounds, you use their weight in pounds divided by their height in inches squared, and you total that whole product and multiply it by 703. You can use either of these formulations to derive the patient's body mass index. Body mass index is broken down into four broad categories. Underweight category is anyone with a BMI of less than or equal to 18.5. Anyone who has normal weight has a BMI of 18.5 to 24.9. Anyone with a BMI of 25 to 29.9 is considered overweight, and anyone with a BMI of 30 or greater is considered obese. Again, recall that patients who are defined as being morbidly obese have a BMI of greater than or equal to 40.